Hello everyone, Dr. Sindhu. So today I'm going to tell you about the tips for normal delivery. So from when you should start preparing for yourself to have a normal delivery. It is the desire of every patient, and for that matter, for every doctor strives really hard to give their patient a normal birth. So there is nothing more natural than having a vaginal delivery. Yeah, so there are certain situations where there are medical indications where we'll be forced to do a cesarean section, but that part is for the later stages. Yeah, so from the beginning of the pregnancy, from your side, what you have to do to prepare yourself to have a normal delivery, for that matter, from when you should start preparing yourself, from when you should start doing your exercises, and what are the exercises which will help you to go towards having a normal vaginal delivery. I'm going to tell you about everything, yeah, step by step. There are like I'm planning like around 9 to 10 points which you should keep in mind and which you should follow throughout your pregnancy. Okay, so just because your delivery is happening at the end of the 9 months, if you start exercising like around 7th month or 8th month, and if you're willing, that desire is always there. Okay, everybody wants to have a normal delivery, but for that you need to prepare yourself from the beginning of the pregnancy, if possible from before even you plan for the pregnancy. So first and foremost is, if you are a physically active person who is been doing physical activity before you gotten pregnant, for you it will be a very smooth ride, because you're not going to do anything new or anything. So you're just going to follow whatever you used to follow all this time. So if you are a person who has not exercised at all, okay, it doesn't matter, okay, whether you are a person who was physically active or not. So the moment you get pregnant, or the moment you know that you're pregnant, you should start exercising in the sense, it need not be anything very extraordinary. You need not go to gym and do some very intense workout or anything like that. Just go for a walk. First and foremost is, that's very, very important. If you're a person who likes swimming, that is the best exercise you can do during pregnancy. There is no contraindication for swimming, so swimming is the best option. If you are not a person who knows swimming or who doesn't swim, then the next best option would be to go for a walk. Yeah, every day throughout your pregnancy, make sure you walk at least 30 to 40 minutes. That definitely has a long-term benefits. That means that will definitely push you towards having a normal delivery. So the day, from the first day of your pregnancy till the day you get into labor, that is very, very important. Unless there is some times, there might be some situations where your doctor might tell you not to do any exercises. So in certain situations, you can definitely avoid it. Otherwise, there is no contraindication for doing swimming or doing the brisk walking during pregnancy. The first and foremost is the exercise. Yeah, second thing is, watch your diet. Yeah, so what you're eating, don't indulge yourself in lots of junk and lots of heavily carbonated drinks and sugary drinks and everything. So this will tend to make you gain more weight, and it will tend to create kind of an inflammatory response in your body, and overall it might put your pregnancy at a high risk. You might risk developing some hypertension or diabetes or anything in the later part of the pregnancy. The pregnancy is not a short duration. It is going to be there for at least 9 months. So the diet and what you eat on a daily basis definitely has a impact on what kind of delivery you are going to have at the end of your pregnancy. So watch your diet. Third important thing is, there are a few exercises which you should definitely do along with your brisk walking and along with your proper diet. So third one is, there is one exercise called Kegels exercise. Kegels exercise is nothing but, it's the muscle, it's the exercise which will help you to strengthen your pelvic muscles. That means the pelvic floor. Okay, the pelvis is nothing but from where your vagina, your the urethra, the bladder opening, everything is situated. So Kegels is not a very special exercise. You don't need any special equipment or anything to do it. So as you're watching this video, you can just try this one. Okay, just try to hold your perineal muscles as if you're holding your urine. Yeah, just hold it for 10 to 15 seconds and then relax. Yeah, so whenever you are having free time, if you're working at office, if you're cooking, if you're sitting at home and watching TV, just try to squeeze your perineal muscles at least for 15 seconds, 10 seconds. I know you can improve it as the time goes on. You might not be able to hold it for more than 15 seconds. Okay, slowly it'll improve. In a day, once you started, at least do it 10 repetitions in a day. Do it 3 times, like once in the morning, once in the afternoon, and once in the evening. At least 3 repetitions in a day would be a very good thing to do for your pelvis. And at the later trimester, in this third trimester, it will help the baby's head to descend also. Yeah, because when the baby's head is coming out, the flexibility of the perineal muscles is very, very important. The more the perineal muscles are flexible, the more they are stretchable, it will be easy for the delivery of the baby. Okay, it's very, very important. So the next exercise is squats. Squats are no special exercise. It's a simple exercise where everybody knows in this picture as you're seeing. So where you will bend on your knees and go down and come up. Yeah, you can support yourself with some you can support the railing of the bed, or you can support your whichever is a stable surface, and then you can try to go down on your knees and come up. As you're doing it, try to breathe in and breathe out. So this is also a very good exercise which will help for the baby's head to descend inside when you are doing this in the later trimester. So you can definitely do these exercises from the first trimester, second trimester, and the third trimester as well. Okay, so this is one more exercise. Third exercise is the cat and the cow pose. Okay, this is one of the special exercises which is very helpful in strengthening your pelvis, and which will also help to descend the baby's head down. Okay, so you will bend your back and make a cat pose, and you will lift your neck and make a cow pose or a dog pose. That's called it's cat and dog poses. So you do this exercise, so that is also very helpful. It is very useful when you do this in the third trimester of pregnancy. Important exercise is a butterfly pose. So it's one of the poses which is very famous in yoga also. So you should sit on your on the floor and try to spread your legs, and you should flap it up and down with your thighs, so that it will help your the head to descend down. So this is also one of the very good exercises which you should follow. Okay, there are no special all sophisticated exercises and everything to do throughout the pregnancy. So if you are sincerely following these 5: brisk walking, and the Kegels exercise, the butterfly pose, the squats, and the cat and the cow pose, so these things will definitely help you in descent of the head and everything. So be careful, if at all, if you are in the third trimester, if says you are having a breech presentation or something like that, avoid all these exercises, because it might push you into labor. When you are having a breech presentation, it's not a very good thing to have the breech to get engaged, because it will prevent the baby from turning. So if you are having any thing like breech presentation where the baby is upside down, so avoid all these exercises. Otherwise, if you're having a normal pregnancy where there is no other contraindications, like you're having some asthma or some diabetes or some hypertension which will restrict you from doing some exercises, there should not be anything which should stop you from doing all these exercises. Yeah, so exercise part is done. So next important thing what you should know is, so prepare yourself for that for your delivery date or the due date, because most of the people, when they are in the OPD, when they come for their antenatal checkups and everything, they'll be very keen, they'll be very much asking for doctor, I want to definitely have a normal delivery, I don't want to have a cesarean section and everything. But when the time comes, when they are in that labor pain, so because of the pain, they'll be very much you will lose your self, you will lose your self-confidence that time. So because the pain will be that much, labor pain, nobody can define, okay, nobody can answer that question also, how painful is the labor pains. So there are many modalities, there are many breathing exercises which you can follow, and first and foremost is prepare for that pain. Okay, it should not come as a shocker. You can Google it, you can talk to your friends, you can talk to your own doctor, and prepare for that day. And don't underestimate anything, because don't keep in mind everything will be okay, everything will be fine. Okay, so it might not be like that, because once the pain starts, you might lose all those strength whatever you had throughout your pregnancy. So keep that thing in mind, prepare for the pain, and ask for the options which are available. If there is anything you can do for that pain, like you can ask about the epidural analgesia. So it's a very good thing. There are many myths about epidural, like if you take it you'll have some back pain and everything, but it's not true. If epidural is a very good thing for having a painless labor, so if you want it, so if you are taking the epidural at the proper timing, it will be very good, and you can definitely have a not so much pain free, but definitely a less painful labor, I would say. Okay, so talk about the labor analgesia, whatever is available. Yeah, so previously it used to be like that, people used to go through this labor process with so much of pain and everything. Nowadays people have invented so much of medicines and everything, so there are injections, and there are inhalational medicines and everything available for the labor analgesia. If there is a facility and if you want it, you can definitely avail those things. Okay, and next important thing is have a strong support system, in the sense, okay, have a person who is strong when you are in the labor. Maybe it's your husband, maybe it's your mother. So have somebody who will support you throughout that process of labor, because it is not going to end in 1 or 2 hours. So it depends upon person to person. For some people the duration of labor will be like very short, within 4 to 5 hours they might deliver. For some people it might take more than 10 hours, 12 hours also. Throughout that time you need somebody who is strong enough, who is somebody who is giving you some positive impact, who is giving you all the positive vibes and everything. So choose that person wisely. Maybe your husband is more scared than you, so he wouldn't help you throughout your labor. So in that case, maybe you should choose a person who is very strong and who is supportive in that matter. So it's up to you at the end of the day who you choose to be with throughout the labor. So I guess that's it about the tips and what and all exercises people are been asking about me about it, like what exercises, what are the exercises we should do to promote normal delivery. So these are the exercises you should definitely follow, and if you're sincere in it, it will definitely give you a good results. Okay, so having a desire to have a normal delivery is definitely very good, and it's definitely important. At the same point of the time, you should also give some space, and you should also be prepared yourself for a possibility of a cesarean section also, because as long as the baby is coming out and we are getting the baby inside to our hands, we can't surely say, nobody can 100% say definitely you're going to have a normal delivery. Yeah, so every effort and every thing will be towards giving you a normal delivery. But at the end of the day, it's always the safety of the mother and safety of the baby. So at the end of the day, both of them should be safe and sound. So just be prepared for either ways. Okay, so I guess that's it about the tips you should follow to have a normal delivery. I'll see you all in the next video. Till then, take care and drink plenty of water. Bye bye.